World Blood Cancer Day will be observed on Wednesday this week. The day aims to draw attention to blood cancers such as leukemia, lymphoma, and myeloma, and raise global awareness on these deadly cancer strains. Beyond blood cancers, though, the overall cancer treatment and research picture in the country has become slightly more complicated with the recent withdrawal of all United States funding aid, much of which went to world-class healthcare research done in this country. Nowhere is this phenomenon best exemplified than in the recent closure of the clinical HIV research unit's cervical cancer screening and prevention clinic in Johannesburg. Let's find out more about that and the clinic's closure and its impact on research and treatment of cervical cancer from Dr. Mark Fison, who is a specialist, a gynecologist and fertility specialist at CHRU. Doc, good afternoon. Thank you for your time this afternoon. Take me back to what happened to, in fact, before we get to the closure, tell me about the work that was being done at this clinic and how important it was in the fight against cervical cancer.
Good afternoon. Thank you for having me. We started about 20 years ago in the Tembaleto HIV clinic, where we found that there was a need for pap smear screening, cervical cancer screening among HIV-positive women. And slowly that expanded to a fully fledged cervical cancer screening and prevention unit, including pap smears and colposcopy and treatment of high-grade lesions, the lesions before it is a cancer. Over the years, the clinic has grown steadily, and we've taken away a big load of work from the public hospitals. And most of it was funded through the Presidential Emergency Fund for HIV Relief, PEPFAR. And with the almost overnight closure of the funding there, the funding then has run out for our clinic to sustain itself. And this week we had our last clinic. We have no funds anymore to continue.
How devastating is that, given the need that I imagine you would have picked up for these kinds of services over the last 20 years?
Oh, it's absolutely devastating. We get referrals from as far north as Midrand, for south in Bella Vista. We get sometimes even referrals from the far east Rand, the whole city, Johannesburg City Bowl. We get referrals from all over the metropole. And not only the patients are going to suffer, but also our healthcare workers are going to suffer. We had to retrench 5 permanent staff and 3 contract workers. And all the research projects that we are doing in the unit have come to a standstill.
So let's talk about the ability to pick up these cancers quite early so that there's early intervention, because time is of the essence. Tell me about that element of the work that you've been doing. And as you say, I mean, getting referrals from public hospitals, I imagine that it had the effect of lessening the load on the already strained public health system.
Absolutely. So the whole principle of screening is to detect early before it is becoming problematic. And that is exactly the whole importance of cervical cancer screening. Women who go for regular pap smears will never get cervical cancer. That's a given fact. So the basis of the work is pure prevention of cancers. Unfortunately, we still diagnose plenty of cancers among HIV positive and HIV negative women because the screening was started too late, or the referrals came late, or the results were ignored.
And now, Doc, now that you've had your last clinic this week, what's the thinking around the potential to revive the services that you've been providing, alternatives for funding, as well as maybe the conversation that you've been having with the Department of Health, among others, about possibly working together to carve out new sources of funding?
So we as a unit, we have not had direct talks with the Department of Health because we resort under a bigger unit. The negotiations are happening at the moment behind the scenes to try and get funding for all the research work that is done at Wits Health University. that was funded by the USAID funding. But our clinic itself, we need private funding. There's no doubt about it. We can't sustain this on a health budget, on the Department of Health.
How does your unit being taken out of the system fit in with the broader picture around the treatment of not just cervical cancer, but all other kinds of cancers? I mean, for instance, in Gauteng, this ongoing oncology crisis that we've been reporting extensively on. I'm just trying to get a picture of, where every unit that is responding to the situation needs to be plugged in, and when one is plugged out, what kind of impact does it have on the overall picture?
So before we go there, I must say there is a good oncology service in existence. These people work hard. They see enormous amount of patients. And the waiting time is not because they don't want to work. The waiting time is because of the patient load. So cervical cancer prevention is far more important than even treating cervical cancer, because we can avoid the queues in the oncology departments.
And what's your understanding of what happens with the patients that you are seeing up to this point? Do you have any idea of where they're going to turn to? Because if the public sector healthcare system was referring patients to you, and now you are referring back to them, I imagine, what does that picture look like?
So all the patients that we see on an annual basis have to now go to the public hospitals. And we've informed all the clinics that are referring to us that we can't sustain our clinic and that we have to close down. So they are aware. And all these patients now will have to line up in the public health facilities.
Are you hopeful at all, as a parting question, Dr. Mark, are you hopeful at all that through the work that you perhaps are doing in the background and perhaps the appeals you are making for alternative sources of funding, that it can be resuscitated, this unit?
I'm confident that if the funding is coming forward, that we can revive the unit. No doubt about it.
All right, I've got to thank you for your time. Certainly one of those stories that are just the fallout, part of the fallout from the stoppage of all funding, especially the PEPFAR funding. And that's Dr. Mark Fison there, who is a specialist gynecologist and fertility specialist with the CHRU. Just part of the bigger picture of the impact that stoppage of that funding has had in many organizations that were doing research, in particular in the areas around HIV and AIDS, but also, as you just heard there from Dr. Mark Fison, issues to do with cervical cancer, as some say cervical cancer. But yeah, that's really the story. The difficulty continues. What else can be done to try and plug that gap that has been left by the end of that funding from PEPFAR?